Hello, I'm Olivia Harris, a board-certified family medicine physician.
In episode 1 I covered what high blood pressure and high cholesterol are, why they are dangerous, and how to read your numbers. In episode 2 I gave you the specific foods that raise both conditions, and the specific foods proven to lower them. Today in episode 3 I am answering the questions I hear most often in clinical practice. Do you have to take blood pressure and cholesterol medication forever? Is it safe to refuse medication? Can you ever get off medication once you start? I am going to answer all of these directly and honestly. Episode 4 delivers the complete prevention lifestyle, including exercise, sleep and stress management. Subscribe with notifications on so you do not miss it. The most common question first. Do you have to take blood pressure medication for life once you start? This belief stops many people from starting medication when they genuinely need it. The honest answer is not necessarily, but in most cases long-term use is required. Here is why. Hypertension is not a curable condition. The underlying factors driving elevated blood pressure, whether lifestyle, genetics or both, remain present when medication stops. In most people, stopping medication causes blood pressure to return to elevated levels. However, there is an important qualification. When lifestyle changes are substantial and sustained, some patients can reduce medication dosage or discontinue it entirely. A 2020 American Journal of Hypertension study found that, with aggressive lifestyle modification, approximately 40% of stage 1 hypertension patients maintained normal blood pressure without medication. Discontinuing medication is possible for some people, but never discontinue without physician supervision. Stopping abruptly can cause blood pressure to spike rapidly, substantially increasing stroke and heart attack risk. When medication is actually necessary, not every person with elevated readings requires medication immediately. Physicians weigh multiple factors when making this decision. For blood pressure medication, the threshold is generally sustained, readings at or above 140 systolic. But the number alone does not determine the decision. Additional risk factors are weighted heavily. Diabetes, smoking, existing cardiovascular disease, family history of cardiovascular disease, obesity. The more risk factors present, the more urgently medication is recommended, even at lower blood pressure readings. For patients without significant additional risk factors, physicians typically recommend 3 to 6 months of lifestyle modification first. If lifestyle changes normalize blood pressure within that window, medication may not be required. For cholesterol medication, the LDL number alone does not determine treatment. Overall cardiovascular risk is assessed comprehensively. Patients with existing cardiovascular disease need LDL below 70, and medication is almost always required to reach that target. Patients without cardiovascular disease, and few additional risk factors with LDL below 130 may be managed with lifestyle changes alone. Statins, the primary class of cholesterol medication, do more than lower LDL. They reduce vascular inflammation and stabilize arterial plaques. A 2019 Lancet meta-analysis found statin therapy reduced cardiovascular mortality by approximately 22%. For patients who need them, statins are among the most life-saving medications available. Common misconceptions about medication. First misconception: medication damages the body over time. Blood pressure and cholesterol medications are among the most extensively studied drugs in medical history, used by hundreds of millions of people for decades. Side effects exist. ACE inhibitors can cause a persistent dry cough. Calcium channel blockers can cause ankle swelling. Statins can cause muscle aching in some patients. These effects are generally mild and can be addressed by switching to a different medication or adjusting the dose. Compared to the stroke, heart attack, and kidney failure that untreated hypertension and high cholesterol produce, these side effects represent a far smaller health burden. Second misconception: taking medication means you can eat whatever you want. Medication is not a dietary free pass. Diet and medication work synergistically. A patient taking a statin while consuming high saturated fat substantially reduces the medication's effectiveness. Patients who combine medication with an appropriate diet consistently show better cardiovascular outcomes than those relying on medication alone. Third misconception: when your numbers normalize you can stop the medication. This is the most dangerous misconception. Normal readings on medication often reflect the medication working, not the underlying condition resolving. Stopping medication typically causes readings to return to elevated levels. Never adjust or discontinue medication without physician guidance. If you believe your readings have improved sufficiently to reduce medication, discuss this with your doctor who can evaluate objectively. Fourth misconception: natural remedies are safer and equally effective. Garlic, omega-3, berries and other foods do produce measurable improvements in blood pressure and cholesterol. These effects are supplementary, not equivalent to medication for moderate to severe cases. A patient with systolic blood pressure above 160 cannot safely manage that level with dietary changes alone. Severe hypertension requires medication first. Natural approaches work best as complements to medication, or as primary management for mild cases under physician supervision. How to manage medication and lifestyle together. Continue improving your diet even while on medication. The foods from episode 2 remain essential, regardless of whether you take medication. Reducing sodium, adding potassium-rich foods, eating fatty fish twice weekly and starting breakfast with oatmeal all amplify the effect of medication significantly. Monitor your blood pressure at home consistently. Home monitoring is often more accurate than clinic readings. Because white coat hypertension, elevated readings, caused by the stress of a medical appointment, is extremely common. Measure each morning after 5 minutes of rest, before medication and before eating. Bring this log to every physician appointment. Never discontinue medication without medical supervision. If you experience side effects, communicate them to your physician immediately. Most side effects can be resolved by switching to a different medication within the same class or adjusting the dosage. The right medication for each person exists. Finding it may take some adjustment. Get regular monitoring tests. Anyone on blood pressure medication should have blood tests every 3 to 6 months. Kidney function, electrolyte levels and blood glucose should all be checked. Some blood pressure medications affect kidney function and electrolyte balance over time. After 6 months of genuine lifestyle change, discuss medication adjustment with your doctor. If you have consistently improved your diet, started exercising regularly, reduced weight meaningfully and stopped smoking, bring this evidence to your physician. Your doctor can reassess whether medication dose reduction or discontinuation is appropriate, based on your current readings and overall risk profile. This is the correct sequence. Change the lifestyle first, then discuss adjustment. A final word: taking medication is not a failure. Managing your blood pressure and cholesterol is the victory. The goal is having your numbers in a healthy range. The method that achieves that goal is secondary. For those who need medication, it is a tool that protects life. For those who can manage through lifestyle alone, that path is equally valid. What matters is active management. Ignoring these conditions is the only genuinely dangerous choice. Episode 4 brings together everything from this series into a complete prevention and management lifestyle plan. Do not miss it.